Hi, my name's Caitlin, and I will be your student nurse today. I have MAR record B, and my patient's name is Jane Doe, and their date of birth is 1/23/27. Before I get started, I'm going to make sure that I do hand hygiene, maintain proper safety, privacy, body mechanics, and standard precautions. So I'm going to prepare my meds for one client at a time. I'm going to perform any assessments related to the meds, such as taking vital signs like a BP or their temperature. I have nothing indicating on my MAR that I have to do that, so I'm going to move forward with my first check. So my first check would be looking at my med order on my MAR and comparing it to the med distributing system to make sure that I have the meds. So I do. I have my ASA for 81 milligrams. I have my glucophage, 500 milligrams. I have my potassium chloride, 20 milliequivalents, and I have eye drops. So I have all my meds. So that would be my first check. And when I'm doing the first check, I need to make sure that I have the right client. Two identifiers being your name and date of birth, the right medication, right dose, right route, right time, and right documentation. Once I've pulled my meds, I'm going to make sure that none of the tablets need crushed or any capsules need opened, or if the pills need to be given with food or on an empty stomach. I also have nothing stating that any of those considerations need to be taken place. So I'm going to move on to my second step. My second check would be making sure I have the right dose and calculating the right dose. Once again, when I do my second check, I want to make sure that I have the right client. Two identifiers being their name and date of birth, the right medication, dose, route, time, and documentation. And once again, if they have any allergies, and my patient does not have any allergies. So for my second check, I noticed that my potassium chloride, the order is for 10 milliequivalents, but I have 20 milliequivalents available. So I'm going to have to score this tablet. So I'm going to take my pill cutter. I'm going to swab it with my alcohol pad to make sure there's no residue from a previous medication. I'm going to open up my potassium chloride. I'm going to stick it in the pill cutter and score it. And that way I have the correct dose for all of them now. And I have the 10 milliequivalents that the order is requesting. So once I am done with my third check, my second check, I can move on to my third check, which would be giving the medications at bedside for my client. So when I get to the bedside, I will once again make sure I have the correct client, make sure I have two identifiers being their name and date of birth, make sure I have the right medication, the right dose, the right route, the right time, and the right documentation. And once again, about the allergies, they do not have any allergies. So I'm going to do my oral meds first. So I will hand my client the meds. I will make sure that I am doing the proper body mechanics. I did hand hygiene, proper safety and privacy. I will put the patient up in the right position, which would be sitting, and make sure that I have adequate fluid for them to take the meds. I will give them the meds, and I would remain there until I know that they have taken all of the meds. And then once I'm done with the meds, I'm going to do the eye drops. So I'm going to take my non-dominant hand and I'm going to pull down on their eye and have the client look up with their eye. I'm going to put the eyedropper above, and I'm going to make sure it doesn't touch their eyeball or eyelashes. And I'm going to administer 2 drops in each eye. And I'm going to make sure the drops are going into the conjunctival sac. And then once I'm done, I would release, of holding down their eye, I would release it. And I would have them close their eyes and move their eye around. And once they have done that, I will make sure that nothing's coming out. And if there is, I would have to do it over again. And then once I'm done, I would remove the eye drops and throw away my cup for my meds. I would do hand hygiene. I would document on the MAR everything that I've given them. And then I would reassess them for therapeutic effects that we want, and if they're experiencing any side effects or adverse reactions. And then my oral pass would be done, and so would my eye drops be done.